What is psoriasis? Psoriasis is a chronic autoimmune condition that causes the rapid buildup of skin cells. This buildup of cells causes scaling on the skin's surface. Inflammation and redness around the scales is fairly common. Typical psoriatic scales are whitish silver and develop in thick, red patches. Sometimes, these patches will crack and bleed. Psoriasis is the result of a sped-up skin production process. Typically, skin cells grow deep in the skin and slowly rise to the surface. Eventually, they fall off. The typical life cycle of a skin cell is 1 month. In people with psoriasis, this production process may occur in just a few days. Because of this, skin cells don't have time to fall off. This rapid overproduction leads to the buildup of skin cells. Scales typically develop on joints, such elbows and knees. They may develop anywhere on the body, including the hands, feet, neck, scalp, face. Less common types of psoriasis affect the nails, the mouth, and the area around genitals. What are the different types of psoriasis? There are 5 types of psoriasis. Plaque psoriasis. Plaque psoriasis is the most common type of psoriasis. The American Academy of Dermatology (AAD) estimates that about 80% of people with the condition have plaque psoriasis. It causes red, inflamed patches that cover areas of the skin. These patches are often covered with whitish silver scales or plaques. These plaques are commonly found on the elbows, knees, and scalp. Guttate psoriasis. Guttate psoriasis is common in childhood. This type of psoriasis causes small pink spots. The most common sites for guttate psoriasis include the torso, arms, and legs. These spots are rarely thick or raised like plaque psoriasis. Pustular psoriasis. Pustular psoriasis is more common in adults. It causes white, pus-filled blisters and broad areas of red, inflamed skin. Pustular psoriasis is typically localized to smaller areas of the body, such as the hands or feet, but it can be widespread. Inverse psoriasis. Inverse psoriasis causes bright areas of red, shiny, inflamed skin. Patches of inverse psoriasis develop under armpits or breasts, in the groin, or around skin folds in the genitals. Ectodermic psoriasis. Ectodermic psoriasis is a severe and very rare type of psoriasis. This form often covers large sections of the body at once. The skin almost appears sunburned. Scales that develop often slough off in large sections or sheets. It's not uncommon for a person with this type of psoriasis to run a fever or become very ill. This type can be life-threatening, so individuals should see a doctor immediately. Check out pictures of the different types of psoriasis. What are the symptoms? Psoriasis symptoms differ from person to person and depend on the type of psoriasis. Areas of psoriasis can be as small as a few flakes on the scalp or elbow, or cover the majority of the body. The most common symptoms of plaque psoriasis include red, raised, inflamed patches of skin, whitish silver scales or plaques on the red patches, dry skin that may crack and bleed, soreness around patches, itching and burning sensations around patches, thick, pitted nails, painful, swollen joints. When you have no active signs of the condition, you may be in remission. That doesn't mean psoriasis won't come back, but for now you're symptom-free. Is psoriasis contagious? Psoriasis isn't contagious. You can't pass the skin condition from one person to another. Touching a psoriatic lesion on another person won't cause you to develop the condition. It's important to be educated on the condition, as many people think psoriasis is contagious. What causes psoriasis? Doctors are unclear as to what causes psoriasis. However, thanks to decades of research, they have a general idea of 2 key factors: genetics and the immune system. Immune system psoriasis is an autoimmune condition. Autoimmune conditions are the result of the body attacking itself. In the case of psoriasis, white blood cells known as T cells mistakenly attack the skin cells. In a typical body, white blood cells are deployed to attack and destroy invading bacteria and fight infections. This mistaken attack causes the skin cell production process to go into overdrive. The sped-up skin cell production causes new skin cells to develop too quickly. They are pushed to the skin surface, where they pile up. Genetics: some people inherit genes that make them more likely to develop psoriasis. If you have an immediate family member with the skin condition, your risk for developing psoriasis is higher. However, the percentage of people who have psoriasis and a genetic predisposition is small. Approximately 2 to 3% of people with the gene develop the condition, according to the National Psoriasis Foundation (NPF). Read more about the causes of psoriasis. Diagnosing psoriasis. 2 tests or examinations may be necessary to diagnose psoriasis. Physical examination. Most doctors are able to make a diagnosis with a simple physical exam. Symptoms of psoriasis are typically evident and easy to distinguish from other conditions that may cause similar symptoms. During this exam, be sure to show your doctor all areas of concern. In addition, let your doctor know if any family members have the condition. Biopsy. If the symptoms are unclear or if your doctor wants to confirm their suspected diagnosis, they may take a small sample of skin. This is known as a biopsy. The skin will be sent to a lab, where it'll be examined under a microscope. The examination can diagnose the type of psoriasis you have. It can also rule out other possible disorders or infections. The most common triggers for psoriasis include stress. Unusually high stress may trigger a flare-up. If you learn to reduce and manage your stress, you can reduce and possibly prevent flare-ups. Alcohol. Heavy alcohol use can trigger psoriasis flare-ups. If you excessively use alcohol, psoriasis outbreaks may be more frequent. Reducing alcohol consumption is smart for more than just your skin too. Your doctor can help you form a plan to quit drinking if you need help. Injury. An accident, cut, or scrape may trigger a flare-up. Shots, vaccines, and sunburns can also trigger a new outbreak. Medications. Some medications are considered psoriasis triggers. These medications include lithium, antimalarial medications, high blood pressure medication. Infection. Psoriasis is caused, at least in part, by the immune system mistakenly attacking healthy skin cells. If you're sick or battling an infection, your immune system will go into overdrive to fight the infection. This might start another psoriasis flare-up. Strep throat is a common trigger. Here are 10 more psoriasis triggers you can avoid. Treatment options for psoriasis. Psoriasis has no cure. Treatments aim to reduce inflammation and scales, slow the growth of skin cells, and remove plaques. Psoriasis treatments fall into 3 categories. Topical treatments. Creams and ointments applied directly to the skin can be helpful for reducing mild to moderate psoriasis. Topical psoriasis treatments include topical corticosteroids, topical retinoids, anthralin, vitamin D analogs, salicylic acid, moisturizer. Systemic medications. These medications include methotrexate, cyclosporin, Sandimmune, biologics, retinoids. Light therapy. This psoriasis treatment uses ultraviolet (UV) or natural light. Sunlight kills the overactive white blood cells that are attacking healthy skin cells and causing the rapid cell growth. Both UVA and UVB light may be helpful in reducing symptoms of mild to moderate psoriasis. Medication for psoriasis. If you have moderate to severe psoriasis, or if psoriasis stops responding to other treatments, your doctor may consider an oral or injected medication. The most common oral and injected medications used to treat psoriasis include biologics. This class of medications alters your immune system and prevents interactions between your immune system and inflammatory pathways. These medications are injected or given through intravenous (IV) infusion. Retinoids. Retinoids reduce skin cell production. Once you stop using them, symptoms of psoriasis will likely return. Side effects include hair loss and lip inflammation. People who are pregnant or may become pregnant within the next 3 years shouldn't take retinoids because of the risk of possible birth defects. Cyclosporin. Cyclosporin, Sandimmune, prevents the immune system's response. This can ease symptoms of psoriasis. It also means you have a weakened immune system, so you may become sick more easily. Side effects include kidney problems and high blood pressure. Methotrexate. Like cyclosporin, methotrexate suppresses the immune system. It may cause fewer side effects when used in low doses. It can cause serious side effects in the long term. Serious side effects include liver damage and reduced production of red and white blood cells.